Good day, my dear postgraduate students. Welcome to today's short topic on ELISA. This is a technical topic and we shall try to become as familiar as possible with the methodology, the alterations, the advantages, disadvantages, applications, etc. And I hope you people appreciate the picture on the screen. Techniques are particularly important because they are part of a question paper. In fact, a majority of it. So this I would like you people to have in mind, and whether it is possible for me to cover or not, you shall not omit techniques. Enzyme link immunosorbent assay. It is a labeled immunoassay and is considered the gold standard of immunoassay. Assay means measurement, and there are some terms which we should be familiar with. Antigen. It is a substance which, when introduced into the body, leads to the production of antibodies. They should be specific. The antigen and antibody together will form a complex which can be measured. The test is very sensitive and it is used to detect and quantify. That is the advantage of it. Quantify substances such as antibodies, antigens, proteins, glycoproteins, hormones, etc. There are two teams of scientists in the history behind this. Evan Engvall, Peter Perlman, and Van Beeman and Schurz. These two sets of people have led to the evolution of the ELISA, and probably the other techniques are to follow. It is a modified form of radioimmunoassay. So, radioimmunoassay by itself is a question, chemiluminescence is a question, ELISA is a question. So, we shall be having a fundamental of it. I shall be covering the others in the days to come. So, you find that there is an antigen and antibody that is tagged onto a substrate which can be identified, and the entire thing either seen or measured. HCG, for example, is measured with human reactive protein rather than radioimmuno 125. What are the basic features of it? The antibody is a protein that is formed by the immune system against an antigen. That was the definition I had given you earlier. This will lead to a cascade of events. And ELISA is a technique that will be able to identify the antigen or the antibody. And we should notice that only a small amount of sample is required for this. And what we are seeing on the screen is amazing. There is a set of 96 wells, and these are called the probes, which are fed with the sample, and they are being delivered to each of the wells. The wells are fed, and then subsequently you find that the antibody, etc., is being added. You find that the microtips will be discarded. In this one, normally you find that there is a single sample for a single test, but sometimes multiple for multiple tests can also be used. Such is the advantage. So there is a quantitative and a qualitative method. I would like you people to kindly by heart this. Chromogenic reporter molecules and substrates are there. Second one, it can be fluorogenic. Third one, quantitative RCL, electrochemiluminescence. And there is something called as ultra-sensitive enzyme-based ELISA, quite latest 2012. So some of these are non-enzymatic and some of them are enzymatic. I would like you people to kindly memorize this particular list. Now, what are the requirements for it? What are the specimen and the procedure? You find that there can be polyester plates. I had shown you a plate with 96 wells earlier. There can be the primary and the secondary antibodies. Analyte or the antigen, and then there is a coating antibody. So what will happen is the substance and the antigen are being coupled together, or the antibody and the antigen are being coupled together, and they are being washed with a buffer. And if it is going to be an adherent substance, it will remain, whereas all the non-specific ones are getting washed off. These are later on measured or identified by means of a substrate or a chromogen. There are four main steps. One is coating of the wells with either an antigen or an antibody. Blocking so that non-specific substances are not getting attached. Third one will be a detection. And fourth one is a reading. So in this case, there is a well, there is an antibody. Why is the antibody? And then there is probably an inactivated antigen. And again to this, there is another antibody that is being attached. Sometimes we can have an antibody to an antibody. And finally, you have got a coloring substrate which helps us identify and measure. So this is one. There are two things that we will have to remember. One is human reactive protein. Kindly change this I. And another is alanine phosphatase. We look at this one, a number of wells, 12 into 12, maybe 144, or 12 into 8 can be leading to 96. 96 wells are over here. See, this is what is happening. So there is something. So streptavidin is supposed to be a binding material. Then there is a probe. And you find that there can be a labeled ampylon. Finally, there is an antibody and there is a substrate or a coloring substance. So this is how it happens. You find that the wells are being coated with the specific substance, then the antibody to the substrate, which can be identified and measured. As I mentioned earlier, it can be for a single sample, single antigen, or it can be for multiple. This gentleman, particularly Emerson, is one of my favorite motivators. The reward of a thing well done is having done it. Ralph Waldo Emerson. Types of ELISA. It can be direct, it can be indirect. There is a sandwich technique and a competitive ELISA. So what do they mean? So there is something over here which I am seeing. So direct ELISA, indirect, sandwich, and a competitive. There is an antigen in the well, and then there is an antibody to which the substrate is being attached and identified. Indirect means you find initially there is an antibody, and then there is an antibody to the antibody, and primary and a secondary antibody. Finally, there is a substrate. So this is called an indirect ELISA, something similar to your indirect Coombs test. Sandwich ELISA is one. There is an antibody, the antigen is trapped between the antibodies, so it is a sandwich. Again, another antibody is there with a substrate. Sandwich ELISA. Same principle is there for the IHC also. And competitive ELISA. Competitive ELISA means you find that there is one substance that is getting attached to the antibody, whereas the others are devoid of it. So it is an inhibitor antigen which is being prevented. What is once well done is done forever. Henry David Thoreau, a brainy quote. So this I have already explained. I would like you people to kindly appreciate it. Only thing, the precision has mattered, and all of these are being adjusted by means of fine instruments called as microtip pipettes. This is for the identification of the amyloid. Basically, there are two types of techniques. One is the sandwich and the ELISA. So in this one, I find that there is, to determine the thing, antibody over here, and there is a detection. There is one antibody, there is something like a sandwich over here, another secondary antibody, and a substrate that is being attached. Whereas in another one, it is more direct over here. So two things are there which could be identified. Just a demonstration thanks to ResearchGate. What are the advantages of ELISA? It is a fast test. Multiple samples can be run in a few hours. Sensitivity is very high. Even a small quantum can be measured. Specificity is again high. There are specific antibodies. Many samples can be processed simultaneously. I had shown you. Small sample size. Calorimetric method, therefore, the human component has been removed. Spectrophotometer can be used for measuring. The test for antigen and antibody. So there is not much of visualization. Human error is minimized. There is a flexible usage and it is easy to perform. The disadvantages can be, you find that it is a measurement of an enzyme activity complex, not a tissue also. Enzyme activity can be affected by the plasma membranes. So that is somewhat different. Probably when there is going to be some kind of a lysis or a rupture of the enzyme, there can be a change. The kits are quite expensive, very specific to peculiar antigen. That is why the companies thrive on them. False positive, false negative is probable. And particularly when there is a mutation of the antigen, we can get a wrong result. What are the diagnostic tests? To detect and measure the presence of antibodies, hepatitis, for example, HIV, and to detect the various levels of tumor markers, such as prostate-specific antigen, carcinoembryonic antigen. The challenges in ELISA are the test has to be done at room temperature, but the reagents are being refrigerated. Therefore, they should be brought to the room temperature. Dilution rules must be exactly followed. And if necessary, a greater amount of incubation time can be given. The recommended wavelength and filter must be used, and that should not be missed. You'll have to prevent the non-specific binding of the antibody to avoid any background staining. Background is non-specific staining, which can lead to a wrong result. And the substrate has to be stored in dark. These are some of the challenges that we should be following. This time, like all times, is a very good time if we but know what to do with it. Ralph Waldo Emerson. So that is exactly what I am doing. I am trying to make use of it for the benefit of my students. What are the uses of ELISA? To detect and measure the presence of antibodies in the blood. There can be autoantibodies, anti-DNA, or anti-DSG1, anti-nuclear antibody, etc. Antibodies against infectious diseases, antibacterial, viral, fungal, etc. Detect and estimate the levels of the tumor markers. I had mentioned two, prostate-specific antigen and carcinoembryonic antigen. Various hormone levels can be detected or even measured. Luteinizing hormone, follicle stimulating hormone, prolactin, testosterone, HCG, etc. Sometimes during an outbreak, this test can be used. Example, cholera, influenza, and to detect any case of a past exposure, it can be used. Detecting past exposures, it can be HIV, hepatitis, Lyme's disease, etc. And screening and of the donors, as in the case of a blood bank, definitely this is being done for anti-HIV 1 and 2, anti-HCV, HPSAG. Definitely this is a screening method that is being followed in the blood bank. Detecting drug abuse, the quantum of it and the presence can be identified. There are two methods of this, direct ELISA and indirect ELISA. The key points are this. In this, the antibody is enzyme conjugated, whereas here the antigen is being detected by means of the antibody. Advantages of there is only one antibody, it is faster, less error. Indirect, you find that multiple binding sites, higher sensitivity, fewer enzyme conjugate, but there is a greater amount of flexibility. Disadvantages of this is each target needs its own enzyme conjugated antibody and its own incubation time. There is no amplification. Whereas here, the disadvantage is an extra antibody is needed because it is indirect. And the possibility of a background staining is the longer protocol. So this has to be perfectly followed. If you can't explain it simply, you don't understand it well enough. Probably this is a lesson I will have to take from Albert Einstein. Thank you, students, for your patient listening.